Hi, my name is Brian Padden and I'm from ACE Training. I want to talk to you today about ACEs. ACEs are adverse childhood experiences. It's probably the biggest public health crisis we've got in this country and probably the biggest public health crisis we've got in the developed world. Very few people know about it. The term ACEs was first termed by a doctor in America, Dr. Vincent Folletti, in the late 1990s. He was an obesity doctor working in the clinic with his patients who had been obese, lost a lot of weight just to put the weight back on. And he was working out why had someone struggled with the weight all their life and then put it on when they'd lost it. And he was using a questionnaire to trace weight gain and weight loss. And one of his questions was, how much did you weigh when you first became sexually active? One of his patients said around about 40 pounds. That's the weight of a small child. When he dug a bit further into the answer, he discovered that she weighed about 40 pounds, a small child, when her grandfather started raping her. He dug a bit further into this with his other patients and found that 52% of his patients had been sexually abused as children. This got him to thinking what else would happen in childhood to cause someone to have health problems later in life, because obviously obesity can cause problems like diabetes and heart attacks and strokes and cancers. So he drew up a list of 10 what he classed as adverse childhood experiences, and then looked at the physical health problems that people who had had these ACEs had in later life. Now, he discovered that if you had physical abuse, sexual abuse, emotional abuse and neglect, if you had a parent who was mentally ill, a parent who had drug or alcohol problems, a parent in prison, a parent who died, or as a child you've been a witness to domestic violence, they were his ACEs. That the more of these events you had, the worse your physical health was in later life, with a massive increase according to how many ACEs you had. It affected things like you're more susceptible to liver disease, heart attacks, strokes, cancers, diabetes, asthma, lots and lots of other illnesses and diseases as well. And that's just the physical health. The research also looked at mental health, and again, the correlation between the amount of these adversities that had been suffered in childhood, the worse mental health became, with the increase in anxiety, depression, things like self-harm and suicide attempts, to the point where if the child has more than 7 ACEs, their chance of attempting to take their own life is 20% higher than the child with no ACEs. There's also the social aspect. We know that, again, with the increase of ACEs becomes an increase in social problems such as mental health problems, drug use, being involved in crime, being imprisoned, having successive failed relationships, being a victim of violence, being a perpetrator of violence, and again suicide risks and early death. So it's a massive problem, but not many people know about it. I first heard about it about 3 or 4 years ago, when I was doing some research into mental health and counselling with children, and then I took part in my own research project with a primary school in the north of England. I interviewed 9 teachers who between them had over 100 years of teaching experience within primary schools. Not one of them had heard of the expression ACEs. And not many people have. Most people who work with children have got no idea. Just the term just doesn't exist. But it's a real problem, and the problem is caused not by the event so much, but how the event causes the difference in brain structure. So when a child goes through a traumatic experience, the body releases a stress hormone called cortisol. This cortisol activates a part of the brain which is the limbic system, more commonly known as the fight or flight response. And the more that the child is in a state of fight or flight or a state of stress, the stronger that part of the brain becomes. Now, the other part of the brain, which is the prefrontal cortex, That's the part of the brain that's responsible for behaviour control, impulse control, regulating emotions. It's also important for things like concentration, focus, being able to think about consequences of action, being able to complete tasks, being able to start tasks, all the things that's really important in a child in terms of learning, education and being successful socially, successful in schools. Now the limbic part of the brain, which is the stress part of the brain, is activated. The other part of the brain, the rational, sensible, calm part of the brain, is deactivated. If that happens often, the prefrontal cortex, the change is the actual architecture of the brain. The neural pathways, instead of developing, actually wither and prune and die away, and the prefrontal and the neural pathways within the limbic part of the brain are actually overactivated, so they effectively becomes a default brain. That obviously has an impact on the child within school, but actually has an impact way beyond school life into adulthood, and we see an increase in homelessness, we see an increase in drug addiction, we see an increase in imprisonment, we see an increase in mental health problems, we see an increase in physical health problems, gambling addictions, that kind of thing. So it has a huge knock-on effect right through school life, and then potentially early death through the disease or increased risk of suicide. As I say, the biggest public health problem that we don't know about. So what I'm doing now is I'm training people within schools, within care homes, to work with these children. What we need to do is to work with these children in a way where we appreciate that their stressed brain is taking over, and when we feel that they are stressed, we need to work with them in a way which calms them down, regulates them, de-stresses them, and gives them techniques to do it. I'm currently working with a cohort of children who are in care, looked after children, and for them, they are the most vulnerable children in education, probably the most vulnerable children in our country. 63% of children that go into care because of abuse, and we know when one form of abuse happens, more often followed by 2 or 3 other types of abuse. And we usually see that there's potentially violence at home, drug use at home, alcohol use at home, and that has a massive effect on the child's brain and their ability to cope without getting stressed. With the children that I've worked with quite closely, I'm seeing a difference. I'm seeing them being able to regulate their behaviour, control their impulses, be calmer, calm down quicker after an incident, think before an incident occurs. But what we need to do is we need to work with all the people that surround them children, the whole team, all the teachers, all the support assistants, all the classroom assistants, all the carers, all the parents, and everybody needs to have this trauma-informed awareness. It started in the UK, in Scotland, 2 or 3 brilliant people, Suzanne Dudek, Pauline Scott. I find them on Twitter, they're really good. They've launched this big trauma-aware movement. It's happening a lot in Wales. The first study in the UK was done by Mark Bellis from Bangor University, but it's slow to pick up in England. And that's why I'm trying to help a little bit in raising awareness of it. Anyone that works with children should be aware of ACES, should be aware of trauma, should be aware of how trauma affects the brain, underdevelops part of it, overdevelops another part of it, with disastrous consequences. So what we think is every school, every nursery, every sports coach, everyone that has contact with children should have a fully trauma-informed approach to working with those children who have come from difficult, damaged backgrounds. Thanks for listening.